I'm not able to comment on how MP compares to other states, but I'm quite excited about some of the work that the Department of Health in Madhya Pradesh is doing to be able to reduce out of pocket expenditure, reduce the friction that patients encounter when trying to navigate the health space, and to improve the quality of healthcare. So, for example, if you look at the pilot that the government of MP is doing in Shehor district, it's a very simple intervention, but it elevates both quality and reduces the friction. If you today go and let's say you have an immunization requirement, or you are having 5 days of fever, you land up at a public health facility. Um, I mean, if you need emergency care, are you attended on immediately? If there's a long queue, where do you come in the queue? 19th century methods of dealing with that was to actually stand in a queue, because that is FIFO, first in, first out. But 21st century ways of solving for that is actually to take an appointment. So that's what they are piloting. And I'm very hopeful that from the results of the Sehor pilot, this sort of method of deploying the Ayushman Bharat digital mission for creating electronic health records, for giving concrete and credible appointments, and to use triaging, a call center, to be able to identify patients who need emergency transportation or emergency care, so that they are not just equated with everybody else. And maternal mortality, infant mortality, all can, and the quality of care can be elevated. And I'm very hopeful that Madhya Pradesh government will become a leader and show to the rest of the country how this can be done. If you look at it, India is very uniquely placed compared to many other countries in the world. Now, if you look at healthcare, the principal problem in healthcare today is that there are no standards through which different technology platforms can communicate. You take Apollo Hospital, a very sort of, high quality provider. Max, there are so many of them in the country. But they have their technology systems which are in a silo. I'm a patient. Today I may go to Apollo, tomorrow I may go to Max. Day after tomorrow I may go to a government facility, All India Institute of Medical Sciences. I may go to my district hospital. My health record is mine. But today, all over the world, they do not have the ability for interoperability. Because of Ayushman Bharat digital mission, we are perhaps the first country in the planet where this interoperability based on a consent architecture is going to become possible. That's number one. Number two, look at the India stack. We have an ID system. We have UPI, the payment system. The moment you have an ID system and a payment system, and then you have interoperability between your digital platforms, a whole new world opens up, where your electronic health record can actually be subject to quality audits. You can then benchmark healthcare delivering units, teams, hospitals based on the quality of care. And you can actually create a new market, which today technology makes possible. If you look at the early writings of people like Kenneth Arrow, Nobel laureate Kenneth Arrow, where he talks of the impossibility of a credible health market because of the information asymmetry between doctor and patient. That need no longer be the case, and India is going to be one of the first countries in the world which is going to make possible informed choice, both by investors, informed choice by care seekers. So it's a whole new world, and COVID, with all the detrimental effects it has had, has given a new fillip to be able to leverage technology in the service of sectors like health.